I appreciate this opportunity that has been given to us by the Special Envoy, Your Excellency Sampaio, for inviting us. And I'm very, very privileged to have an opportunity to address your distinguished excellencies, heads of state and government, prime ministers present here this afternoon, your Excellency First Lady of the Republic of Uganda, heads of of Rwanda. Oh, I beg your pardon. I beg your pardon. I really apologize. I've just come back from Uganda, but I definitely know. I visited your country, Madam First Lady. As you know, Rwanda is an excellent example of development, growth, and process and progress that we are all extremely proud to be associated with. And I would like to recognize the heads of UN agencies and institutions who are here this afternoon, distinguished excellencies, ministers, heads of delegations, and members of our most important partners, civil society groups, and members of the media, and distinguished guests. I believe the panelists today, particularly the first panel, took you through the enormity of the challenge. So I will not address the enormity of the challenge, nor indeed the technical response, which has been enunciated so clearly by the head of WHO, or the practical experience of countries, as Madam Kagame has just enunciated. But I would like to focus on basically 3 points. One, the compelling economic basis for action. Secondly, who is going to benefit from these actions, whether they be economic, whether they be health-related, whether they be societal in nature, or whether they be community empowerment in nature. And who should be involved in taking this action, and what our role is within the World Bank. First of all, one of the most compelling arguments is that HIV/AIDS and TB remain a huge barrier to achieving the MDGs. We have conclusive evidence that its negative effects on economic growth and the exacerbating effects that it has on poverty, therefore compromising not just MDG 1, but the affiliated MDGs such as MDG 2 and MDG 3. With its heavy direct and indirect costs at household level, which impede access, it also compromises access to all other activities, whether it is health services, education services, or social services. The impact of the co-infection of HIV/AIDS and TB has plunged lots of households, affected households, into poverty. And we have enough evidence that demonstrates that these households that are affected experience much higher levels of poverty than other households. And what is even more exacerbating is that there is an intergenerational transfer of poverty amongst these households from one generation to another, further exacerbated by the fact that it is usually the elderly who end up bearing the burden of bringing up the young. And therefore the negative effects on nutritional status of women and children devastates any efforts and any investments that we may be making in MDG 4 and 5. Now we have the human and economic costs that can further be broken down beyond the effects that I have just enunciated on the MDGs. The huge loss of economic productivity amongst working adults and the direct costs of treatments on poor households mean household spending on TB account for 80 to 20% of annual household income. And children in affected families drop out of school at an exceedingly high rate or seek employment very early when they do not yet have skills that can enable them to enter the labor market. The economic impact of the premature death, as you well know, is devastating. And We have gone further than that as a global community to investigate the compelling arguments for investing and for implementing the global plan to stop TB and to address the 12-point approach that WHO just enunciated, as well as paying special attention to the 3 I's. And it is very, very clear that the implementation of these plans exceeds the cost by a factor of about 9 or above. This is a very compelling argument. It is a compelling argument because the benefits are greatest in African countries with high levels of HIV. This, therefore, brings to the fore how critical it is for us to take action now, because the effective TB control does not only benefit the families and the communities, but the economy, and it is therefore a wise economic investment. We see the key players who need to play a role in this, not just as being the people who are living with HIV/AIDS, people who are living with tuberculosis, and the health sector, whether private or public, but we see it as an important challenge to the policy institutions in countries, whether they be parliaments or whether they be cabinets or any policy and financing structures that set the goals and standards and key functions within the economy. We see it as a major challenge to the scientific community for them to promote research and development and epidemiological surveillance. We see it as a challenge to those of us who are responsible for capacity building, the institutions that support countries in establishing and financing mechanisms that are going to enable the effective management of these programs and put in sustainability mechanisms so that individuals can indeed be responsible for their own health and be able to contribute positively to economic growth. We see the institutions that deal with social instruments in the economy, not just social protection, but the building and the addressing of mechanisms that address inequities in risks and outcomes so that we can protect vulnerable population. We see the not-for-profit private sector and the private sector as being key partners, and I think this has been clearly enunciated by the speaker before me, so that we can build a strong coalition across sectors, we can reach vulnerable population, we can apply the skills that we know work, we can mobilize resources, and we can indeed ensure that the benefits filter down or are owned by communities. The World Bank sees itself as playing as a partner at the table together with you, assuming the responsibility together with other institutions for building capacity and working under the leadership of countries, under the support of country-led strategies, increasing knowledge of what works and how and where it can work best, responding to country requests to finance TB, HIV/AIDS programs, and emphasizing measurable and sustainable impact within a well-structured and governed response. Thank you.
Thank you.